Hey there, viewers. We all go through the occasional aches and pains. In fact, it's the pain that tells us something is wrong and we need to visit a doctor. But what if we have consistent pain, one that just doesn't go away? In today's video, we'll be talking about chronic pain in detail. What is it? What causes chronic pain? What is chronic fatigue syndrome? Can endometriosis and fibromyalgia be a cause? What about inflammatory bowel disease? We'll be talking about all of this and more. What is chronic pain? Pain is your body's way of letting you know it's hurting. When you suffer an injury, pain signals go through your spinal cord and all the way up to your brain. When the injury heals, the pain goes away. But sometimes you have aches and pains that are chronic. This means your body is sending signals to the brain about an injury even after it has healed. Chronic pain can last from days to years. Most people with chronic pain find it troubling to move around and will struggle with flexibility. You might find it difficult to get through daily tasks, especially if the pain is severe. Experts estimate there are at least 1.5 billion people around the world who experience chronic pain. In the United States itself, that number comes to around 100 million and is the most common cause of long-term disability. Causes of chronic pain. The main cause of chronic pain is an injury like a pulled muscle or back sprain. It's likely the injury would have damaged your nerves, making the pain long-lasting and more often than not really intense. So even if the initial injury has been treated, it's still going to hurt. You may have to try medication or other options to relieve your pain. There are times you may suffer chronic pain without any injury whatsoever. While the reason for this is not fully understood, there are certain underlying conditions that are known to cause chronic pain. Let's talk about them. But first, what's the worst injury you've ever had? How long did it take to heal? Share your stories and experiences with the Bestie community in the comments below. Number 1. Chronic fatigue syndrome. Also known as CFS, this is a disorder where you feel extremely tired even after getting the proper amount of sleep. There is usually no underlying medical condition that can explain it. Some of the physical symptoms of CFS include muscle pain and multi-joint pain without redness or swelling. If you suffer chronic pain and get tired quickly, CFS could be one of the causes. Anyone can be affected by CFS, but it's most commonly seen among women in their 40s and 50s. While there's no permanent cure for CFS, there are some treatment options that can help reduce the pain. Number 2. Endometriosis. This is a condition that affects women. It's when there's another tissue similar to the one that lines the uterus growing outside the cavity. When there are hormonal changes during your menstrual cycle, the misplaced tissue gets affected. The entire area can become inflamed and cause joint pain. Over a period of time, the tissue will thicken and break down. Because there's nowhere to go for the tissue, it gets trapped around the pelvis. This condition can cause severe pain during your periods. There are several other painful symptoms that come with endometriosis. You can experience pain in your lower abdomen during menstruation and also feel cramps around 1 or 2 weeks before it. You might experience pain after getting intimate, or maybe when you're using the toilet. It's a common gynecological condition that about 10% of women are affected by. Looking for answers on all the latest health and wellness news? Hit that subscribe button and join our millions of followers. Stay up to date on all of our great Bestie content. Number 3. Fibromyalgia. Fibromyalgia is a chronic condition in itself. This is where you experience a lot of pain in your bones and muscles. You'll also see a few areas of tenderness develop. This disorder causes fatigue and sleep disturbances. You'll have regions of pain where you feel a dull ache. While the disorder is mostly diagnosed based on the severity of pain rather than duration, it's one of the causes of chronic pain among people. People with fibromyalgia will experience an overreaction from their brain and nerves. The reason for this overreaction is because of a chemical imbalance in the brain, which can increase sensitivity levels. Before we move ahead, are you worried about your health? Well, here's another video you might be interested in. Watch this video to learn more about the 10 body changes that require immediate attention. Now back to the health conditions that cause chronic pain. Number 4. Inflammatory bowel disease. Also known as IBD, this is a condition where you have prolonged inflammation in the digestive tract. This is not an individual disorder. IBD is an actual umbrella term for a number of diseases that cause problems for your digestive tract. While the major symptoms of IBD include diarrhea, bleeding ulcers, and anemia, You'll also experience stomach pain and cramping. This happens due to an obstruction in your bowels. This condition can be chronic, and you may experience pain for a long time. According to estimates, about 1.6 million people in the United States suffer from IBD. People who have a parent or sibling with IBD tend to also exhibit the symptoms, which is why scientists believe genetics also play a role in the disorder. Number 5. Interstitial cystitis. This condition occurs as the result of chronic inflammation in the bladder's muscle layers. As a result, you experience pain in the pelvic and abdominal areas. You'll also feel the need to pee more than you normally do. The pain you feel because of IC will range from mild or severe. Even the degree of pain can be inconsistent. You'll be hurting all the time, or only every now and then. Some even experience periods of remission where there's no pain at all. Just when you think it's gone away for good, it starts back up again. Experts estimate there are more than 12 million people in the United States affected by IC. It's a more common issue among women, but the condition can affect men and children as well. Number 6. Temporomandibular joint dysfunction. I know it's a complicated one. Also known as TMJ, the temporomandibular joint is the part that connects your lower jaw to your skull. You'll see this joint on both sides of your head and in front of your ears. The function of this joint, as you may have already guessed, is to help you open and close your jaws. A TMJ dysfunction usually happens because of trauma experienced by the jaw. There are certain underlying health conditions, such as arthritis, that can cause this disorder as well. If you're in the habit of grinding your teeth, or you happen to have jaw issues, there's a good chance you'll have this problem. The main symptom of TMJ dysfunction is pain in your face and neck. You'll also feel stiffness in your jaw. You might even feel the pain on only one side, which can really throw you off. According to experts, there are as many as 10 million people in the United States who are affected by TMJ dysfunction. This is another disorder that is more common among women than men. While it is a treatable disorder, the underlying cause can be hard to diagnose because it could be from a number of reasons. Number 7. Vulvodynia. Vulvodynia is a condition where women face pain in their vulva. There's no obvious cause for this particular condition, but the pain can be severe. You might experience a burning sensation in that area, as well as a really bad itch. The pain you experience from vulvodynia lasts for at least 3 months. Chronic pain can be very challenging to manage. Since it interferes with your daily functioning, it brings on even more stress. Lower back and diabetic nerve pain are two of the more common pains that can really interrupt your life. Fortunately, there are ways to deal with them safely and effectively. Here's 2 videos. Check out the 13 best ways to ease diabetic nerve pain, or how about 8 safe and effective exercises for lower back pain. Go ahead, click one, or better yet, watch both and learn more about how to relieve pain. Do you suffer from chronic pain? Let us know in the comments below.